there are, unfortunately, in Europe, there's not just one concept of informed consent. There are several ones. They have different legal bases and they have different legal traditions. One of them is the concept of consent into data processing. Another one is the concept of consent into the treatment. And the third one is the concept of consent into the research undertaken. And those three concepts are similar, but they are not identical. And researchers doing research with medical information therefore need to be in line with all three concepts. I think the most important argument is that you need to be in control of your information in order to be able to build trust on what happens with your data. And putting you into the control for allowing you to build up trust needs your knowledge on what's going on and your agreement on what's going on. When it comes to informed consent and medical research, there is another reason for this, because there's a very long and very important tradition also in medical law that for very obvious reasons the patient needs to be informed and the patient needs to agree on what's going to happen with her, and not only in the treatment part but also in the research part. However, there might be situations where this concept of informed consent comes to its limits. The first and very easily imaginable situation where this can happen is when the patient deceased. When there is no longer a patient living, there is no longer somebody who could give the consent. So that's the first setting where informed consent reaches its limit. A second setting might be that the patient does not want to be recontacted a long time after he had given his informed consent. However, the physician or the researcher having the data asks or thinks that he should ask or she should ask a new research question. So if you have on the one hand a patient no longer wanting to be contacted, on the other hand a researcher wanting to do new research, then the answer ask for informed consent might also not be the best answer to give. And the third situation might be a patient gives informed consent to a specific research question. It then turns out that there is another interesting research question, but for organizational or privacy-related reasons, it's no longer possible or feasible to recontact the patient. And this is, of course, the scenario where this balance between patient's interests, society's interests, and the researcher's interests is the most difficult to get into balance. So there should be a very big red alert that whenever you do research on personal information that is not covered by an informed consent of the patient, this needs to be an exceptional situation, and this needs to be very, very properly analyzed before it starts. And it needs the involvement not only of the researcher, but also of ethics committees, data protection authorities, and patient interest groups. And finally, the general public. So you should also be, that's also very important, you should be as transparent and as publicly viewable as you could imagine, because it's important that society understands what you're doing.